Today we are going to speak about the clinical pharmacology of Gastrin. So topic that will be covered in this section, we are going to speak about peptic ulcer disease, GERD, gastroesophageal reflux disease, nausea and vomiting, constipation and diarrhea, and some other gastrointestinal disorders such as IBD, IBS, which stand for irritable bowel disease and irritable bowel syndrome. So peptic ulcer disease may be defined as a disruption in the mucosal integrity of the stomach and or the duodenum. This will lead to the local defect on the mucosa and excavation. A patient may suffer from abdominal pain, epigastric pain, nausea, vomiting, loss of appetite, heartburn, and bloating. A patient may come to the hospital or emergency room with a complication of peptic ulcer disease, such as bleeding. We have obstruction and perforation. All these complications may require surgery. Before we go in depth about the peptic ulcer disease, we need to treatment. So before we start speaking about the pharmacology of peptic ulcer disease, we need to understand the physiology and pathophysiology of GI system, and especially the stomach and the intestine. As we all know that we have three main pathways affect the GI system, and the first pathway we call this one neural transmitter. So we have neurons there, and this neuron release acetylcholine. So the first neuron, parasympathetic neuron, release acetylcholine, and this acetylcholine stimulate muscarinic receptor M3 receptor. Then we move to the endocrine transmitter. This type of cells release gastrin, and this gastrin stimulate CCK2 receptor, which stands for calcitonin receptor. So again, this stimulates calcitonin receptor. And we have another major effect with the paracrine and adjacent cells. This adjacent cells called enterochromaffin cells, and this cells release histamine. Histamine stimulate H2 receptor. H here stands for histamine. And as you can see here, what type of histamine we have here? We have H2 receptor. And we need to remind you we have H1 and we have H2. So the H1 mainly involved in allergy disease, all allergic disease. H2 mainly available in the GI system and involved in peptic ulcer disease. So allergic disease here we talk about antihistamine, anti-allergic drugs. Okay, so you can, from what we have in the beginning, we have three main mediators there, but we have another, maybe mediator number 4 here. We can add this one here, number 4. We have another component on the stomach, and this component called prostaglandin, and we are going to speak about prostaglandin later on. Okay, speaking about the etiology of peptic ulcer disease, the causes of peptic ulcer disease, this could be related to the bacterial, and this bacterial called Helicobacter pylori. Okay, could be bacterial Helicobacter pylori, and they found to play important role in peptic ulcer disease. Could be related to the stress, and you can see here stress may cause peptic ulcer disease, and this is considered like acute case. And another issue here, we have some important factors, NSAID, non-steroidal anti-inflammatory drugs. So you can see here we have three main factors or possible causes of peptic ulcer disease. Number 1, Helicobacter pylori. We talk about bacteria here. Number 2, we talk about stress, anxiety, may cause acute ulcer disease, and medication drugs, and the most popular drugs will be NSAID. We have some aggravating factors, could be emotional stress, smoking, alcohol, and drugs. So we have some other factor may aggravate the situation. This slide briefly discusses causes, symptoms, and diagnosis of peptic ulcer disease. As we mentioned, we have three common causes of peptic ulcer disease. We have Helicobacter pylori, NSAID, or stress-related. Patient may come to the clinic suffer from abdominal pain, heartburn, could be pain in the GI system, 1 to 3 hours after eating. And if you speak about a duodenal ulcer, if you talk about gastric ulcer, the pain associated with eating. So here, when the patient take food, they start suffer from pain. With the gastric ulcer, with duodenal ulcer, they said pain start after 1 to 3 hours of eating. Okay, or after eating. So moving to the diagnosis here, we move to the best way to perform an endoscopy to the patient. During the endoscopy, if we found the ulcers there, we recommend to take biopsy, and the biopsy to maybe identify or exclude the availability of Helicobacter pylori. So endoscopy and biopsy. We have some other tests for H. pylori, and urea breath test, for example, we can do it for the H. pylori. So endoscopy, biopsy, urea test, and we have other tests could be used for diagnosis, and this will be explained in details in other courses. So as you can see here, we have causes, we have symptoms, and then we have diagnosis. Okay, so in order to understand how the NSAID drugs or other drugs may affect the gastrointestinal system and cause ulcers, we need to look on the physiology and what happened on the GI system. Then we move to the medication, apply our medication in this system. First, if you look on the cell membrane, and the cell membrane here we have cell membrane, and then we have double layer of lipid here and membrane. And the cell membrane here, we have something called membrane phospholipid. And you can see the membrane phospholipid here under the effect of enzyme called phospholipase A2 will maybe responsible for synthesis of arachidonic acid. Arachidonic acid has two main pathways. The first main pathway called lipooxygenase. So the first pathway called lipooxygenase, and the second pathway called cyclooxygenase. So as you can see here, if you talk about if you speak about arachidonic acid, talking about arachidonic acid, we have two main pathway. We have lipooxygenase and another pathway called cyclooxygenase. So we have two main pathways. Lipooxygenase is responsible for synthesis of leukotriene, and cyclooxygenase is responsible for synthesis of prostaglandin. So this one, for simplicity, arachidonic acid, we have two main pathways. The first pathway involves enzyme called cyclooxygenase, and abbreviation COX, and the second enzyme lipooxygenase, and abbreviation LOX. The cyclooxygenase ended up with the formulation of prostaglandin, and lipooxygenase will lead to the formation of leukotriene. So for example, leukotriene is already covered in the topic related to the asthma, for example. We cover this one in the asthma and COPD, and I refer you to that lectures, which is available already on YouTube. Okay, speaking about COX, cyclooxygenase, and formation of prostaglandin, you can see here from the graph or the image here what we have. Arachidonic acid, we have two types of cyclooxygenase. We have cyclooxygenase 1, as you can see it here, and then we have cyclooxygenase 2. So they said cyclooxygenase 1 is considered like housekeeping. It's very important, responsible for physiological action. So COX-1 responsible for physiological action. Please remember that. So homeostatic, responsible for physiological actions. This enzyme will lead to the formation of prostaglandin. Several types of prostaglandin, could be E1 or E2 and other prostaglandin, and the most important prostaglandin called thromboxane A2. So you can see here we have prostaglandin in general, thromboxane A2, the most important one. Then move what target, what organ will be affected with this type of enzyme of prostaglandin. They said if you talk about the GI system, if you talk about the gastrointestinal system, stomach and intestine, prostaglandin has a gastroprotection effect. So prostaglandin protect the GI system, gastroprotection. This is our topic here. So we need prostaglandin to protect our stomach. Prostaglandin also involved in the renal function. Okay, prostaglandin, thromboxane A2, this type of prostaglandin lead to the increased platelet aggregation and vasoconstriction. And this topics covered already in the maybe lecture related to the antiplatelet. Okay, so we covered this one in the antiplatelets. This is not our topic today, but we are focusing on the GI system. So the topic now, prostaglandin has gastroprotection effect on the GI system. This is an important one. The question now, you can see here that we have first type of enzyme called cyclooxygenase. They said, okay, on the other hand, our body lead to the formation for another enzyme called cyclooxygenase 2. And cyclooxygenase 2 responsible for synthesis of type of prostaglandin in general, several type, and one of the most important one called the prostacyclin. Okay, so COX-2 lead to the formation of prostaglandin. This prostaglandin responsible for pain, fever, and inflammation. Okay, so I'm going to focus on the GI system now, not on the blood disorder, for example. So you can see here cyclooxygenase responsible for specific formation of prostaglandin. This type of prostaglandin, COX-2 prostaglandin, you can see we have pain, fever, and inflammation. Okay, this is the reason why some patients, if they suffer from pain, they take ibuprofen, or they take naproxen, or they take like meloxicam or celecoxib. Okay. Okay, so now we try to apply medication here. You can see here, for example, if the patient suffers from headache or like muscle pain, and the patient start using ibuprofen. So the patient start using ibuprofen or naproxen. Okay, ibuprofen, naproxen inhibit. You can see it here. This medication belongs to the something called non-steroidal anti-inflammatory drugs. And they said this type of NSAID work through the blocking cyclooxygenase 1 and cyclooxygenase 2. And you can see it here. Okay, ibuprofen, naproxen block both COX-1 and COX-2. Okay, if you look on the COX-2, when the ibuprofen or naproxen block COX-2, this will lead to the inhibit synthesis of prostaglandin, and the end result will be relief pain, relief fever, and reduce inflammation. That's great. This is what we need from medication. Ibuprofen, naproxen, relief pain, reduce fever, and reduce inflammation. That's great. On the other hand, this NSAID, ibuprofen and naproxen, also inhibit COX-1. And COX-1 responsible for prostaglandin formation, which is responsible for gastroprotection. So when you inhibit COX-1, we omit or delete the effect of prostaglandin as gastroprotection. And on the stomach, we have other factors considered like aggravating factors, may expose the mucus to the maybe harmful factors such as pepsin, such as gastrin, such as hydrochloric acid. So we have other factors, but when you inhibit this COX-1, the result will be irritation to the GI system. Okay, this number one. And what about glucocorticosteroids? Here they said, okay, glucocorticosteroid also inhibit and decrease glucocorticosteroid inhibit and decrease prostaglandin, but with the other mechanism. They said for glucocorticoids or cortisone, prednisone inhibit enzyme called phospholipase A2. So you can see here phospholipase A2 is enzyme required to formation of arachidonic acid. So when the arachidonic acid inhibited, the result will be inhibit COX-1, lead to the decreased formation of COX-1 and COX-2. For this reason, we use it like corticosteroid as anti-inflammatory, number one. And this, at the same time, they found is, okay, this medication may cause ulcer. Okay, so glucocorticosteroids. But they start talking about what is the percentage, how much, if you talk about clinical research, for example, if you prescribe a glucocorticosteroid for to 200 patients, for example, what is the percentage of patients will suffer from peptic ulcer if they treated with the cortisone? They found it's only 2%. So we have low percent of patients may suffer from peptic ulcer disease. If you compare that with the ibuprofen and naproxen, we have large percent compared with the corticosteroids. Okay. Okay, so here we have practice question. The practice question here, they said ibuprofen contribute to the peptic ulcer disease by decreasing production. Which of the following endogenous agents? We have histamine, we have gastrin, prostaglandin, acetylcholine, and serotonin. So we have ibuprofen. So when you read it, okay, we have ibuprofen here, and we know ibuprofen belong to the NSAID. Okay, the ibuprofen lead to peptic ulcer disease by decreasing which of the following. So we're looking for maybe mediator by decreasing by the NSAID. Histamine decrease, no. Gastrin, no. Serotonin, acetylcholine. So the correct answer will be prostaglandin. So the correct answer for ibuprofen decrease formation of endogenous substance and lead to the peptic ulcer disease. Okay, which of the following are common causes of peptic ulcer disease? Select all that apply. I will start from last one. Cirrhosis, yes or no? If you said no, you are correct. Okay, Crohn disease, yes or no? Common causes of peptic ulcer disease, no. Viral infections, no. What about emotional stress? Yes. What about NSAID? Yes. And Helicobacter pylori? Yes. Zollinger Allison? No, it's not. But it's rare. Could be caused, but it's rare. Rare cases. So you can see the most common popular causes of peptic ulcer disease: Helicobacter pylori, NSAID, and emotional stress. Maybe a brief introduction to the physiology, pathophysiology, signs, symptom, causes. Now we start with the management of peptic ulcer. Management of peptic ulcer disease. We have non-pharmacological approach treatment and we have pharmacological approach treatment. For non-pharmacological approach treatment, we recommend patient to eliminate or reduce stress. We recommend patient to eliminate and reduce or stop smoking, cigarette smoking. We recommend patient to stop using NSAID, especially the non-selective and aspirin. Okay, we recommend patient to avoid spicy food and caffeine, a lot of caffeine and alcohol. We recommend patient to replace NSAID, for example, with acetaminophen or other COX such as celecoxib. Okay, so could be acetaminophen, celecoxib, depends on the case. Some patient, if they suffer from complication of peptic ulcer disease such as bleeding, obstruction, or perforation, we have some elective surgery could be performed for this emergency case. Emergency cases here. Okay, so we need surgery for this case. Okay, so stress, alcohol, caffeine, spicy food, cigarette smoking, okay. Pharmacological treatment, how we can treat the patients. Here we have groups of medication could be used to treat peptic ulcer disease. We have suppression acid secretion. Okay, which medication decrease secretion of acid? Medication decrease secretion of acid. Medication suppress the acid secretion. Number one, proton pump inhibitor, like 80 to 90% of 95% of acid will be inhibited. Histamine, 70% of the acid will be inhibited. Histamine blocker. So number one, proton pump inhibitor, PPIs. Number two, histamine H2 blocker receptor. Number three, muscarinic receptor antagonist. So we have three main group of medication and decrease secretion of acid. Proton pump inhibitor, H2 blocker, histamine H2 blocker, muscarinic receptor antagonist. That's great. Okay, we have the acid in the stomach. So we can use something called neutralization agent or neutralizing agent. Acid neutralization. You can use some acid neutralization agents such as antacid, Malox, for example. What about the mucosal protective agents? We can use sucralfate, bismuth, subsalicylate, prostaglandin analog, such as misoprostol. Okay, if the patient maybe undergoes a endoscopy and biopsy and they confirm infected by the Helicobacter pylori, we can go with the antibiotic, could be combined with the other medication to eradicate Helicobacter pylori. We have amoxicillin, clarithromycin, metronidazole, and tetracycline. So all these group of medication, and we can add some levofloxacin, for example, here. Okay, like this one belongs to the fluoroquinolone. Okay. So we start with the. So I will go back again to remind you. We have a group of medication here. You need to remember all these medication. For example, here, and this is important for us. We have four main group. We use medication to decrease acid secretion, medication to neutralize the acid, medication to protect the stomach, and if we have bacterial, we use some antibiotic to eradicate the bacteria. So here we have the diagram for the treatment of peptic ulcer disease. Four main group: decrease secretion, neutralize acid, mucosal protection, eradicate Helicobacter. So which medication belong to the acid suppression? So we have proton pump, H2 blocker, muscarinic antagonist. Which of these medication neutralize the acid? We have antacid. Which of these medication eradicate the Helicobacter pylori? We have antibiotic amoxicillin, clarithromycin, metronidazole, and tetracycline.